Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Thank you for joining us today in our second video in our neck pain series, where we're going to go over how to differentiate what's going on in your neck. Congratulations on taking that step to really find out exactly where your pain is coming from and what's going on. It's important to figure these things out, especially in the neck, because that's where a lot of nerves are and things that can affect arm function and obviously brain function and things such as that. So it's great that you're here and ready to learn. So in the first video, we went through a couple of the common causes of neck pain. And when I say neck pain, I also mean headaches. Headaches are usually a very good indicator of neck pain or something coming from the neck. Generally, even a tension headache has some originations in the neck. The first one we're going to discuss is a bulging or a herniated disc. These terms are used synonymously in the medical fields. They usually do not mean anything different. It depends on how far the disc is out of place, technically, to use the words bulging or herniated. But at this stage of the game, most physicians, PAs, PTs, all use the word interchangeably. So if you have been diagnosed already with a herniated disc or a bulging disc, know that it's a common thing that we use those words interchangeably. So what happens? What do you feel when you have a bulging disc or a disc that's herniated? And one of the things you have to understand is that most people over the age of 18 who will have an MRI done will have a bulging disc. I have 3 in my back. I don't have any back pain except when I do something stupid or lift something weird the wrong way. So if I got an MRI and someone said to me, oh, you have 3 herniated discs, that's not the cause of my problem. Same thing happens in the neck. A lot of times there will be a bulging disc that shows up on an MRI. Doesn't mean it's the cause of the problem. We have to really look at your symptoms. We have to figure out what's going on. When it comes to the neck, it really takes a lot of figuring out your history, figuring out your symptoms, and different things that we look at in the clinic to figure out exactly what's going on. Because like I said, we get MRI reports all the time that say herniated disc, but in reality, that may be not causing the problem at all or causing just a little bit of the problem. So we want to make sure that we are getting an accurate history, and that's what you're going to do to figure out whether you have a bulging disc or a herniated disc. So if you have numbness or tingling into your hands, if you have lost grip strength, that's an indication of a bulging disc or a herniated disc. Now, it could also be something else, okay? But usually if you have it going into one hand, you have a bulging or a herniated disc. Now, because of the structures of the neck and the shoulder, you could also have some muscle guarding, which we're going to talk about later. So we'll go into a little bit more on how we look at those things as opposed to that. But one of the things that you can't rule out is a herniated disc if you have numbness or tingling in your fingers. If you have started to drop things, that's also a sign of a herniated disc. You want to make sure that you also are not, blowing this off as carpal tunnel syndrome. I get that a lot. I thought it was carpal tunnel syndrome. I thought, people tell me all this numbness and tingling in your hands. I work on computers. Carpal tunnel syndrome has a very distinct numbness and tingling pattern. You're going to feel it in these 3 fingers right here. If your whole hand goes numb, if you're feeling, if you're dropping things and you're having weakness in these 2 fingers, that's not carpal tunnel syndrome, okay? If you're feeling pain from the neck all the way down your arm, that's not carpal tunnel syndrome. So no, we're looking at the thumb and the 2nd and the 3rd fingers really when we're talking about carpal tunnel syndrome. So don't be so quick to dismiss your numbness and tingling as carpal tunnel syndrome. We have to also consider a herniated disc. The next one is stenosis, or it's going to be a narrowing of the canal. And what the canal does is it provides room for that spinal cord and those nerves to run through. When we see stenosis, we see numbness and tingling in both hands. It's very rare that a stenosis patient would present with only numbness or tingling or weakness in one hand. Usually with stenosis, you will also get no relief. So as a herniated disc patient, there's a lot of positions that we can put you in that you will be relieved. And in a stenosis, it doesn't matter if your head's up, down, wherever, the numbness and the tingling stays the same because the canal stays the same. So it's a little bit ambiguous what goes on or how to diagnose that, without an MRI. Usually when we see stenosis on an MRI and we see unrelenting pain or unrelenting numbness and tingling, the reason and the cause is, stenosis. And unfortunately, with that type of diagnosis, there's not a whole lot to be done. The final thing we're going to talk about is muscle guarding. This is what we see in most cervical patients. This is what causes headaches. This is what can cause numbness and tingling. This is what we see in a lot of patients. And muscle guarding is, there's no clear-cut way to diagnose muscle guarding, but what you can do is you can look for a few signs of, are you guarding? So you want to look at where your shoulders are. So right now all you got to do is say, drop my shoulders. If your shoulders fall, like mine just did, you are muscle guarding, okay? You should be able to sit here completely relaxed and not have to shrug your shoulders. Many of you who have a muscle issue in your neck, in a few seconds, if you're not thinking about it, your shoulders are going to start to come up. And you'll be like, drop your shoulders, and they'll drop again. This is the quickest and easiest way to see if there's a muscle guarding component. It may not be the only thing going on, but if there's a muscle guarding component, you're walking around and your shoulders are up here. And a lot of people I talk to and a lot of people I work with say, I know my shoulders are up here. I know I walk around with my shoulders up here. So that's a muscle guarding diagnosis. Now, what happens is that everything comes up, you're actually going to start to irritate the nerves. The shorter those muscles get, the more irritating the nerves are. So you want to make sure that, we don't write numbness and tingling into, the first two categories. We check here. Now, it could be a combination of a herniated disc and muscle guarding while you're having that numbness and tingling. But you want to really not rule out anything. Posture is certainly one of the major culprits of neck pain, numbness and tingling. So we'll go through that a little bit later on. But you need to be aware of things to look for. Another thing to look for is sitting like this at your computer. So if you have someone that you know and you trust and they can come up and look at you or take a snapshot of you on the computer and you're sitting like this, you're muscle guarding and you're herniating your discs. So you want to really be aware of some of these things that are causing the neck pain and some things you can look at home to kind of differentiate where the neck pain is at. Below, you're going to find a survey in the email that we sent that you can call or you can request that we call you for a free phone consultation and just explain to us what's going on so we can have a better idea of where you're at and what your pain is. Getting a complete history is one of the best ways we can help you differentiate what's going on in your neck. So make sure you respond to the email if you want us to help you out a little bit further. If not, you can look in your inbox in a couple days and we'll send you the final neck video that shows you things you can do at home to treat your neck pain.